Hello, welcome to Health Talk. I'm Dr. Manny. What if I told you there is a way to heal yourself before you get sick? My guest today says he can teach anyone to detect an illness just by looking at them. He will show us what indicators we need to be aware of in ourselves and others. Joining me now is John Corton. He's a medical intuitive and author of the Corton Technique. Thank you for coming.
Thank you, Dr. Manny.
I never met a medical intuitive before.
Well, it's a pleasure.
You know, I'm a little frightened. But anyway, I think this is a great thing. It's very interesting. When did you realize that you had the ability to do this?
I was about the age of 8 years old.
Really?
Yes. When I look at people, I notice that they have certain perceptual qualities, that I'm able to use my sense of eyesight, that I detect qualities or properties about people. And over the course of my lifetime, I've learned that those properties or qualities, or what I call organ indicators, relate to each of the body's specific major organ systems.
So when you look at somebody, okay, what do you see? I don't know. You see colors, you see shapes, you see.
There's nothing unique.
Combination, odor. What is it?
No, there's nothing unique or special about my field of vision compared to yours. I just know what I'm looking for when I look at a person. So most of the information that I receive comes from a person's face.
Okay.
So I'm looking at their face. I think of the human being as a gramophone, and the face is the sound horn, where a lot of information comes up and out.
I got a big face. I got a big horn. I got to tell you that. Anyway, but now you're using this technique to help doctors use this in their practices and hospitals. A big field of alternative medicine is popping, and it's becoming, huge, and doing a lot of medical discoveries along the way. So how are doctors taking this?
The doctors that I've worked with have been pretty open.
Okay.
In terms of realizing that there are some unrecognized dimensions of human health and the human organism.
Okay.
So to me, it's very exciting that medical science is embracing this. And the way that was concretized was I was evaluated in a clinical environment.
And have there been studies looking at the accuracy of your findings, or people like yourself?
In my particular evaluation, the accuracy of the findings was 93% accurate.
93%?
Yes.
All right, well, we're not going to put you to the test, but we're going to show you three people. We have three wonderful people. And I want you to kind of examine them, look at them, and tell me what you think they might possess in their medical history.
Okay.
Let's do Melissa first.
So we'll start with Melissa. So as I'm looking at Melissa, one of the properties that I perceive is that there is a concentration. I perceive a density, which tells me she might have something going on with her digestion. Now, as I look at her, it looks to me like it might be more related to the upper intestinal tract rather than the lower intestinal tract. There might be a little bit of cardiovascular indication with her. And a lot of times I will pick up on information that the patient doesn't know about yet, or a medical test cannot detect.
Okay.
So I'm going by the language.
So one of the aspects is sometimes is not getting what the current diagnosis is, but rather the things that are brewing underneath.
Yes, but a lot of times it does concur with the conventional diagnoses.
All right.
And
so that's what we got from Melissa.
Okay,
Melissa, what do you think?
Well, I haven't been diagnosed with any of those conditions yet, but I do sometimes have issues with my GI tract, and I'm always saying, oh, I should get to the GI doctor, and I never do. So maybe this is a good time to maybe go see one. There's cardiovascular disease that runs in my family. Both my grandparents have had heart attacks and bypass surgery, so maybe that's something that I should, check up on as well as I get older, to make sure that doesn't happen to me.
All right.
But currently I'm not being treated for any of those things.
So something to wear. Okay. Kevin, you're up next. What do we got in Kevin?
All right, so as I look at Kevin, I'll just get a little closer.
He has a nice face.
Thank you. He's got a good level of what I call moisture, which tells me that's always good for the body. All the people here have a good level of moisture, so it tells me they have a strong biological power supply to draw upon.
Well, he's young.
But as I look at Kevin, there might be a mild respiratory indication. Okay. As I look at him, and there could be perhaps some prostate indication in the future.
Ooh.
But as I look at him now, his digestion looks all right to me, neurological system looks all right to me. Musculoskeletal system looks all right to me. Maybe something in the past with musculoskeletal, but it looks like it's corrected itself.
All right, so got to worry about your prostate.
Good to know.
And what else did you say? I'm sorry.
It's looking like there might be some respiratory indication.
Okay.
Again, not real severe.
Asthma, allergies?
Nothing of that. Maybe some seasonal allergies. That's about it.
All right.
Yeah, that's about it. The rest of it, I haven't noticed anything, though.
All right. Okay, don't forget to check the prostate as you get older.
Yes.
Believe you me.
Absolutely remember that.
Believe you me. All right, and last but not least, what do you think of her, Jessica?
Let's see. Well, as I look at Jessica again, I perceive a concentration, so could tell me there's something going on with digestion. I also, again, perceive some indication of cardiovascular to keep a lookout for. Let's see here. There could be perhaps something related to blood sugar with her. There could be some elevated blood sugar. So if we were working in a conventional capacity, I might recommend having a blood panel.
Okay. So what did you think?
Well, you got it spot on. There is cardiovascular events in my father's side of the family, so I'm definitely keeping my eye out for that. But I do have severe digestion problems as I suffer from Crohn's.
Okay.
All right. All right. So, well, thank you. I think this is very interesting. And when you do these analyses, one of the things that we were talking prior to organizing the segment, how do people take it? Because to me, this is a little bit like sometimes not that I'm comparing you to, horoscope reader or whatever thing like that, but sometimes people don't want to know what's in the cards. How do people take it? Do they get anxiety from it? Do they accept it? Is it like a doctor sometimes when we say, got to watch out your weight and you got to take care of that? I mean, how do people take the diagnosis sometimes?
Well, I don't approach people in the grocery store in the frozen pizza section.
No, but I mean, I'm sure people read your book and they come up to you and they say, hey, what about me? What about me?
Well, when I meet with people, when they want to come, for a consultation, then I know that they are genuinely interested in what their body has to communicate. And as I've worked with the body, anything that I've said about these people today, the body has information about how they could avert those health imbalances in the future. We don't have to wait 5 or 10 years from now before the prostate might show up.
Right.
There's some action we can take now that could have that be averted. So that's always welcome information.
Yeah, so I think anything that really provides information to patients in regard to risk factors, sometimes, especially the young ones. I mean, these are 3 extremely young people. I think it's important. Last question for me. What do you see in me?
Well, you've got good moisture, Dr. Manny, so you should be around for a while.
With all the alcohol that I drink, I should have.
Well, let's see here. Yeah, there might be a mild, liver indication.
There you go.
Prostate indication. But blood looks good to me. Neurological looks good to me. Digestion looks good to me. Musculoskeletal, I don't see much musculoskeletal going on with you. So
Okay.
Thyroid looks good.
The alcohol again, but it keeps me young and happy. Well, anyway, thank you so much. Where can people get more information?
If you're interested, I make myself very available on the internet, so you can go to www.johnkortum.com.
Okay, very good. And don't forget to pick up the book. It's a great read, very interesting, and you're going to learn a lot of stuff about yourself and the way to look at health in a different perspective. Thank you so much, and thank you, everybody, for joining the panel. And if you have any health questions, you can email me here at Fox at drmanny@foxnews.com. I'm Dr. Manny. Thanks for watching.